Hi, I'm Lindsay. I'm the Chief Exec at the Wallich. There are some hard messages in this report, and for that we make no apologies. But we don't want that to be misconstrued like we're pointing fingers or that we're blaming services for the state of how things are. Some of this is down to global forces that literally nobody is in control of. So I bring this report to you really from a place of humility and a place of gratitude. Speaking as somebody whose life has been saved by mental health services on more than one occasion. I think if we look at the contents of this report, there is despair, but there's also hope. We know what good looks like, and to those social workers, to those mental health practitioners, to those homelessness nurses that are out there really making a difference, we salute you. We know that this doesn't have to continue to be a sad story, although if we're honest, we've all sat here and talked about these issues for many years now. It's time for innovation, it's time to drive change. We need to come together on a level that's never been achieved before. We need to share skills, we need to share information, we need to empower each other to give a better experience for the people that we support. And I think our position of strength is that we all want exactly the same thing. When I went through my illness, I nearly missed the best part of my life, which is now. I nearly missed the best bit. And what I want for the people that we support is that they have that opportunity too, that they don't miss the awesomeness that could be coming their way later down the line when they recover or when their symptoms improve. We acknowledge that sometimes the behaviour we see from the people we support can be really challenging, but we accept that some of those patterns of behaviours might have been what kept them alive this long. We acknowledge that substance misuse will always be there. For as long as humans have a brain, there will be substance use and substance misuse. We acknowledge that we've got to deal with the symptoms as they present. We can't say one symptom has to be dealt with before the other. We can't say abstinence before treatment. It doesn't work like that, and we've known it doesn't work like that for a really long time. Addressing mental health need is a pillar of ending homelessness. And that's one of our key messages of this report. So our asks aren't that extravagant. These are things that have been discussed before. What we would really like to see is us bringing the NICE guidelines to life, where there are no diagnoses of exclusion, where we are dealing with symptoms as they present, and where there's no wrong door to services. We want to see trauma-informed collaborative working. And I'm really heartened to see that as CAMS relaunches for young people, that they're aligning themselves more with the trauma-informed framework for Wales. This is where Wales is going, and there's real strength in that. And most of all, we want to break the barriers to accessing care. We are aligned in our ambition to do better for the people who have experienced homelessness and who find themselves in mental distress. It's time to draw on whatever we can to drive change. That means not just people building relationships on the front line, which in many parts of Wales is working really well. We need to see joint budgets, we need to see joint strategies, we need to see legislation. It's time to innovate at a structural level if we want to see change happening in real life, rather than people just relying on their personal goodwill and the relationships that they've built throughout their professional lives. It's time to decide whether we want to see this change or not. So our call to action is this. What else can we do to come together? Are these the right recommendations? Can you partner with us? We're not sitting here saying that the Wallich is doing everything perfect. We have recommendations for ourselves, and we call on your support to achieve those. Let's continue this conversation.